Introduction on Multi-Drug Resistant MDR Pathogens 1 Professor Mokhtar Kamara. Multi-drug resistant MDR. Organisms heavy checkmark bacteria that have developed resistance to at least 3 different families of antibiotics heavy checkmark. These antibiotics can no longer be used effectively to control or kill the bacteria. Classification of MDR according to origin. Hospital acquired heavy checkmark, community acquired. Loss of hospital and community barrier. 2. Methicillin-resistant Staphylococcus aureus, MRSA. Vancomycin-resistant Enterococci, VRE. Penicillin-resistant Streptococcus pneumoniae, PRSP. Extended-spectrum beta-lactamase Enterobacteriaceae, ESBLE. Carbapenem-resistant Enterobacteriaceae, CRE. Carbapenem-resistant Acinetobacter baumannii, CRAB. Carbapenem-resistant Pseudomonas aeruginosa, IRPA. 3, 4, 5. An existing severe illness, neutropenia, asplenia, etc. An underlying disease or condition, e.g., diabetes, CKD. Immunocompromised patients. Invasive procedures/medical devices, e.g., dialysis catheters. Repeated contact with the healthcare system, e.g., multiple hospital admissions. An extended hospitalization. Mechanical ventilation. Previous colonization with the MDR. Exposure to extensive use of expanded spectrum antibiotics. Beta-lactamines, cephalosporins, carbapenems. Fluoroquinolones. Aminosides. Vancomycin. Recent organ or stem cell transplants. Elderly. Any part of the body. Bloodstream. Lungs. Urinary tract. Wounds. Surgical sites. How are they treated? These are hard to treat because they do not respond to many common antibiotics. Limited alternative treatment options. Leading causes. High healthcare cost. Significantly worse outcomes, mortality rates up to 4 times higher than infections. Caused by susceptible strains. Potential for widespread and rapid transmission. Reinforce hand hygiene and isolation. Wear disposable gloves and possibly gowns when applicable. Family members should be instructed to wash their hands upon entering a patient's room and before leaving the room. Interface with microbiology laboratory, pharmacy, infectious clinic, surgery. For the MDR pathogen surveillance using a One Health approach. Serve on Antimicrobial Subcommittee, Infection Control Committee, Antimicrobial Stewardship Team, Passive Prescriber Education, Standardized Antimicrobial Order Forms, Formulary Restrictions, Prior Approval to Start/Continue, Pharmacy Substitution or Switch, Multidisciplinary Drug Utilization Evaluation, DUE, Interactive Prescriber Education, Provider/unit performance feedback, Computerized decision support/online ordering. 12.